Those of you who don't know me, my name is Kristin Hartsaw. I'm the Director of Training and Technical Assistance at the DuPage Federation. So some of you or your staff know me from many different public benefits trainings. And Dave asked me to focus primarily on Medicaid today. So I've just got 3 quick slides and I'll do my best to summarize this for you. But first, I think it's always important to mention that Medicaid is administered technically by 2 state agencies. We've got the Department of Human Services in Illinois that processes the applications, and then it's the Department of Healthcare and Family Services that really coordinates Medicaid overall in terms of policy and contracting with providers and making requests to the federal CMS, or the Centers for Medicare and Medicaid Services. Both agencies have been fantastic in posting information on their website, so I've just given the links here. In addition to Medicaid, just a quick sidebar, the Illinois Department of Human Services has posted a number of program and policy changes related to SNAP and Medicaid and cash assistance, and you can find all of those policy memos on their website as well. With regards to the Department of Healthcare and Family Services, or HFS, their coronavirus webpage contains a lot of information for medical providers, as well as the requests that they have made to the federal government. And what I can tell you is that the state of Illinois is working very hard to ensure access to care for individuals who might be impacted by COVID-19 specifically. I'd like to give just a couple general explanations for persons who are currently on Medicaid, and then I'm going to shift into what the state is looking to do specific to COVID-19. So for current Medicaid beneficiaries, some of the steps that the state is taking to ensure that access to care is suspending cancellation of Medicaid cases. So as of, I can't remember the exact date, in March, right now I don't have it written down in front of me, but cases should no longer be canceled if someone's currently on Medicaid, unless that client or that patient requests the cancellation, or they've moved out of state, or there's a death. And so this is to, again, to maintain access to coverage for folks so that they can get care, especially if they do become ill due to COVID-19. There's some other process things going on behind the scenes for current Medicaid beneficiaries, but I don't want to spend too much time on that. I think the avoiding case cancellations is an important point, though. I mentioned that HFS is requesting permission to do certain things from the federal CMS, and so these are some of the flexibilities that they're requesting for the Medicaid program. I just checked earlier this morning, I haven't seen anything new. So if we do have any folks from the state on the call and they know of something different with this in particular, I would love to hear that. But they are waiting to hear approval on these particular 1115 waiver requests. The state is committing to covering persons who are uninsured with COVID-19 illness, and so one of the ways they're looking to cover that is by requesting permission from the feds to use Medicaid to cover testing and treatment for this population. In their request, they're requesting that permission for persons who are uninsured regardless of income. It would be limited coverage just for COVID-19 testing and treatment. In addition, for those individuals or families who maybe have health insurance, but they are having high deductibles, or they just really have high cost sharing as part of that private health insurance, they are looking to use Medicaid coverage as a secondary payer, again, for COVID-19 related issues. They're also moving forward with waiving things like the monthly premiums and copays for certain Medicaid programs, again, trying to ensure that access to care. So while this is what's going on, what we're hoping will come, the state has still committed to the idea of covering this COVID-19 related information. And then in addition, there are some things with new applications, setting up expedited processing of Medicaid applications, especially if it is a COVID-19 related case. And so notice has gone out to providers. They've set up a special email address that when it is suspected COVID-19 or confirmed, to submit the application as they normally would, but then email this particular email address to alert them so that they can expedite that. They've also made some accommodations in terms of, the workforce that helps families apply for these benefits. And Paula had mentioned the workforce like certified application counselors or navigators. And so there's a way for us to document consent via telephone so that we can submit those applications. There's also been a couple of flexibilities for providers. I'm not going to get into this. This is a separate type of waiver request that was sent to Fed, the 1135 waiver request, and that was turned around pretty quickly. This ensures access to care by allowing providers to be able to bill Medicaid and some other flexibilities for pharmacy services, telehealth, and more. And I've given you the link. Again, like I said, the state has been great about putting all of this information online. One final thought when it comes to Medicaid, and especially when we think about health disparities, and there's always the concern not only for folks who are uninsured, but maybe for our immigrant population who doesn't have a qualifying immigration status to access Medicaid. And that can include undocumented individuals, but it can also include others with a lawful status that doesn't convey eligibility for Medicaid. There is a program called Emergency Medical Assistance for non-citizens. And so if they meet income requirements, they can submit applications for emergency Medicaid when they present in the emergency department for a life-threatening or an emergent health issue. And it does appear that COVID-19 will be able to fall under that program as well. So before I start going down the rabbit hole, so to speak, I think my takeaway for everyone is that there are a number of options to explore under Medicaid. What we would need from human service providers, healthcare providers, is just educating consumers, connecting them to those trusted resources who can help navigate these applications, and to let us know how it's going. There's a lot of moving parts right now. And so knowing that some of our systems are, seeing high volume of applications and needs for assistance, let us know what's working and what's not working, and we can help troubleshoot.
Thank you, Kristin. Any questions about what Kristin has presented?
And I do see in the chat, thank you, Alam. She said we are still waiting to hear on that 1115 waiver request from CMS. So if any of our representatives are on the phone, Kristin will ask if there's any way we can check on that.
So I just wanted to know more about emergency medical assistance. You said that they have to go to ER, right? That's my understanding.
Yes, so emergency Medicaid's been around for a long time for immigrants who, again, wouldn't be eligible for Medicaid simply because of their immigration status. And so typically that has always included something that's life-threatening, acute onset, that results in an emergency room visit. And if admitted from the ER due to that health condition, there are cases. It's basically a case-by-case basis. You have to send not just the application, but medical records and a physician report form. And then the state will review their eligibility based on all of that medical information. And so historically, that's how it's worked. I think we are still waiting for a little bit more clarity in terms of COVID-19 specific. I think the takeaway is please don't delay care, but certainly seek care, especially if it's COVID-19, and we can work it out, hopefully. That's where that importance of connecting to some of those navigator agencies to assist with that will help.
Thank you.
Yes.
Thank you, Kristin.